Dispositional optimism was measured in, they found after they adjust for all of these different confounders, compared with women in the lowest quartile of optimism, women in the highest quartile of optimism had a 29% reduction for all-cause mortality. I'm Dr. Roger Seheult, and welcome to True Health Tuesdays. Now, I believe there are 8 pillars of true health, and those 8 pillars are nutrition, sleep and rest, exercise, air, water, sunlight, and avoiding toxins. One of the things that we're going to talk about today is your thoughts. So when we talk about True Health Tuesdays, we're usually talking about our physical health. What you'll find, though, when you're talking about physical health is these things can sometimes run seamlessly into mental health Mondays, for instance, or even spiritual things. And so today on our Physical Health Tuesday, we're actually going to get into the realm of our mind, because our mind, let's face it, is in our brains, and our brains are something that is physical. A famous quote from William Shakespeare is in Julius Caesar, Act 3, Scene 2, where Mark Antony is giving the eulogy to Julius Caesar. He says, "Friends, Romans, countrymen, lend me your ears. I've come to bury Caesar, not to praise him. The evil that men do lives after them. The good is often tarred with their bones. So let it be with Caesar." It's interesting that the evil that men do, he says, lives after them. But the good is often left with their bones. People don't think about it. And it could have to do with the fact that we like to think about things that are evil a lot of times. And the question is what effect does this have on our lives? Does your mental approach to life affect your body, your immune system, and even your health? Now, there was this prospective cohort study that was published a number of years ago in 2016. And what they did was they looked at this evidence that links psychological attributes like optimism to a lower risk of poor health outcomes. They say here it's been demonstrated in randomized trials that optimism can actually be learned. If associations between optimism and broader health outcomes are established, it may lead to novel interventions that improve public health and longevity. In the present study, we evaluated the association between optimism and cause-specific mortality in women after considering the role of potential confounding variables, and they used prospective data from the Nurses' Health Study. That's a pretty big health study that's been looked at a number of times, where they looked at nurses who were women. It was about 70,000. Dispositional optimism was measured in 2004, and all-cause and cause-specific mortality rates were assessed from 2006 to 2012. And what they found after they adjust for all of these different confounders, compared with women in the lowest quartile of optimism, women in the highest quartile of optimism had a 29% reduction for all-cause mortality. So, of course, this was an associative study, right? So this was associated, and we know that association does not necessarily mean causation. So what should we do to actually figure out whether or not that is the case? Well, you have to do a randomized controlled trial, a prospective study. And that's exactly what they did with this trial that was published back in 2015, actually. It says, does gratitude writing is when you actually write a letter thanking somebody about something that they've done for you. So does gratitude writing improve the mental health of psychotherapy clients? This is from a randomized controlled trial. So these were participants that were at a university, specifically it was at Indiana University, 293. These were all people that felt like they needed some help. So they were seeking psychotherapy at either a counseling center or a community-based training clinic at Indiana University. And what they did was they divided them into 3 different groups. Those that had psychotherapy only, that was the control group. Those that had psychotherapy and expressive writing about stress experiences, which isn't exactly gratitude writing. And then, of course, those that actually had the gratitude writing. So they wrote 1 letter of gratitude to another person each week for 3 weeks. Now, the funny thing about this is that they didn't actually have to even deliver the letter to the person. All they had to do was write it. And they followed them up at 4 and 12-week follow-ups. And they found that those that did the gratitude writing, so they wrote a letter, had significantly better mental health. And here's the data. So when they do the scores on these GMH, they find that 2.78 is the clinical cutoff sign, that 4 is the best and 0 is the worst. And so what they found here, here's the control group and here's the gratitude writing group here. They found that at every point here, 2.31 versus 2.24 before the intake, that as time went on, those that were in the gratitude writing group had higher GMH scores. And in fact, with 2.78 being the clinical cutoff, the only group to make it over that first was this gratitude writing group. See, as you can see here, these two groups here in T3 and T4 at 4 weeks and 12 weeks were there. And it took to the 4th week for the expressive control and the control group to make it over 2.78. So they say here at times 3 and 4, which is right here, clients in the gratitude condition reported significantly higher GMH scores than those in the other two conditions. And that was statistically significant. So why is this happening? There's 4 reasons why this might be happening based on the author's conclusions. Gratitude unshackles us from toxic emotions. So when you write a letter, that gratitude group had to use more positive words, right? That didn't actually correlate with better outcomes, but they did do it. The gratitude group also used less negative words, and that actually did correlate with better outcomes. So the point here is that it's not dwelling on the positive perhaps, but maybe distracting us from the negative experiences that we should not be experiencing, right? So if we're keeping our mind busy on positive things, we don't have time to dwell on negative things. The second reason is that gratitude helps even if you don't share it, like we talked about. So 23% of the people who actually wrote the letters did share it, but obviously the rest did not. And there was still a benefit even if they didn't send the letter. The study wasn't powered to see whether or not actually sending the letter helped, but we know that not sending the letter did not hurt. It actually helped even if you didn't send the letter. We also noticed here in this study that gratitude benefits take time. Remember, it didn't show up until about 4 and 12 weeks, but it got better with time and it lasted longer. And they also found that 12 weeks after that, looking at functional MRI, when they actually gave money by a benefactor, they actually found in this experiment at 12 weeks that those more grateful gave more money, and it was associated with neural sensitivity in the medial prefrontal cortex, which is part of the brain that deals with this. So gratitude letter writers had even more activity in this area of the brain when experiencing gratitude. So the point here is that this is something that can be learned. Well, here's a study that was done in 2018, and they looked at the positive psychological well-being and cardiovascular disease. And it showed that, people who are depressed and anxious, have anger, PTSD, they all have increased amounts of cardiovascular disease. And they found that anxiety and PTSD appear to be at least as potent risk factors for coronary heart disease as depression. And it actually may confer a confounder in terms of that. So it's a complex interaction, as we found, that cardiovascular health can be affected by health behaviors. Some of these health behaviors are restorative, some of them are destructive, and that stress also plays a role. So they said that in contrast to mindfulness interventions, positive psychology interventions, which is dwelling on things that make you grateful, aim to promote optimism, gratitude, and positive effect directly through activities such as imagining and writing about a better future, recalling positive life events, identifying and using personal strengths, and planning and performing acts of kindness. They say here that positive psychological interventions can be straightforward to deliver and are often feasible and well accepted by patients and may not require extensive provider training. And in fact, they may actually be sustained for up to 3 to 6 months in terms of follow-up. So again, we talk about our 8 pillars: nutrition, sleep, rest, exercise, air, water, sunlight, avoiding toxins. May I add to that the bottom line here, which is constraining your thoughts and making sure that we have positive thoughts in our mind instead of dwelling on the negatives. The other thing that goes along with this is, of course, when bad things happen to you. Of course, that's going to happen and you can't prevent that. But forgiveness And empathy and understanding is also really important as well. It's more than just moving on. It doesn't mean, for instance, that you have to say, well, there's no justice. I mean, justice can happen outside of you. This is something that's actually happening in your own mind and how you relate to this person. It's not a sign of weakness. In fact, it's a sign of strength that you're able to forgive. And this ability to forgive and have empathy is actually linked to reduced anxiety, depression, and major psychiatric disorders, fewer physical health symptoms, and actually lower mortality. And I love this definition of what empathy is, provided by Brene Brown in her book, Atlas of the Heart. She says, quote, "We need to dispel the myth that empathy is walking in someone else's shoes. Rather than walking in your shoes, I need to learn how to listen to the story you tell about what it's like in your shoes and believe you even when it doesn't match my experiences." And that really has harmonized and resonated with me in terms of all the different walks of life that people have gone through in the last 2 years, and how we have really had a lack of dialogue and some distrust when people talk about their experiences. And really, we need to start listening and doing that much more than we have, in my opinion. So what does this look like? Forgiveness, Stress, and Health, a 5-week dynamic parallel process study. Well, here was the study that they did. They addressed the issue by examining how forgiveness, stress, and mental and physical health symptoms change and relate to one another over a 5-week period. They hypothesized that increases in state levels of forgiveness would be associated with decreases in perceptions of stress, which would in turn be related to decreases in mental and physical health symptoms. And I just want to stop there. That again, we're talking about how your brain and your body actually are connected. So again, this is not just, mental Mondays and true health Tuesdays. This is somewhere in between. This is like late Monday going into Tuesday morning care, where there's this combination of mental and the physical. So what they did in this study to actually look at this is they recruited 332 young, middle-aged, and adults, older adults. Each for 5 weeks, participants report on their levels of state of forgiveness, perceived stress, and mental and physical health symptoms. And the levels of forgiveness, stress, and mental and physical health symptoms each showed significant change and individual variability in change over time. And what they found, as hypothesized, is that increases in forgiveness were associated with decreases in stress, which were in turn related to decreases in mental but not physical health symptoms. In other words, what they found is that forgiveness led to less stress, which led to better health. Whereas when they tracked it in the other direction, it didn't fit as well that health led to less stress, led to you forgiving more. So there's been this debate that people who forgive more are more healthy to begin with, and that's why they do that. That's actually not what this showed. This showed that everything starts off with forgiveness, and that eventually leads to better health. So this is why we ought to do this, right? So conclusions of this study is that the study was the first to provide prospective, longitudinal evidence showing that greater forgiveness is associated with less stress, and in turn, better mental health. Strategies for cultivating forgiveness may thus have beneficial effects on stress and health. So we know that people who are angry and people who are depressed, it's not good for your heart, right? So here was another study that looked at this. This was over 200 patients. And what they found was that both in a healthy population and in a diseased population, that when people had less anger and less hostility, there was an improvement in their health. And overall, if you look here again, what they're doing here is they're looking at the effect of anger and hostility in both healthy and diseased populations. And look, this is a meta-analysis. And what you can see here is that most of these boxes here, this is the average box here in this side, and the average boxes on this side, they all fell on this side, which favors less anger and less hostility, goes to better coronary outcomes. And that's the key to understand here. They say here that there's 25 studies investigating CHD or coronary disease outcomes in initially healthy population, and 19 studies with diseased populations. They say that anger and hostility were associated with increased coronary events in the healthy population compared to the other, and with a poor prognosis in the in the coronary disease patients. There were indications of publication bias in these reports, although the fail-safe numbers, which they do an analysis of, showed that it was 2020 and 750 for healthy and diseased population studies, which means that the numbers were actually very robust. Intriguingly, the harmful effect of anger and hostility in coronary disease events in the healthy populations was greater in men. So again, this may seem to affect men more, this idea of hostility and anger. So their overall conclusion was that the current review suggests that anger and hostility are associated with coronary events, outcomes both in healthy and diseased populations. Besides conventional physical and pharmacological interventions, so this would be like cardiac rehab and medications, this supports the use of psychological management focusing on anger and hostility in the prevention and treatment of heart disease. And that brings us down to whether or not forgiveness is actually a public health issue, because we've shown already that the ability to have thankfulness and the ability to forgive are both major interventions that have a benefit in terms of society. And they say here in this paper that was published in 2018, well before the pandemic, that to not address forgiveness is to leave many people trapped in resentment, negative feelings, and rumination of the past. The evidence strongly suggests that forgiveness promotes health in the sense of wholeness of mind and better mental health. In addition, in many theological and moral understandings, forgiveness also promotes health in the broader sense of wholeness of the person. I think that's a key statement there. Also in spiritual well-being. So here we are talking on True Health Tuesdays, not only about the mental, but also about the spiritual. They say here, this isn't a scientific article, just realize this, that the evidence suggests that forgiveness can be facilitated at the individual, couple, or group level by various forgiveness interventions. These could be used with greater frequency. Large-scale randomized trials to definitively establish the efficacy of forgiveness workbook interventions might be especially valuable because of the potential for the easy dissemination of outreach of such workbook interventions. This is really interesting to read because this is exactly what's done when people are engaged in going to church, for instance, which we've shown many studies that show that people who go to church regularly actually have better health outcomes. And it's interesting to note that maybe this is the mechanism by which this is happening, especially in a society where increasingly in secular media, we are seeing increasing stimuli to become angry and incensed at things that are happening. And so I would say that the key pillars of health here are nutrition, sleep and rest, exercise, air, water, sunlight, avoiding toxins. And key here is to constrain your thoughts to things that are good. You know, there was a 19th century health reformer who said this, and I think she was right. This was published back in 1905 in a book called The Ministry of Healing on page 493. So this is well over 100 years old, and even then they had this idea. Listen to what she says here. Earnest workers have no time for dwelling upon the faults of others. We cannot afford to live on the husks of others' faults or failings. Evil speaking is a twofold curse, falling more heavily upon the speaker than upon the hearer. He who scatters the seeds of dissension and strife reap in his own soul the deadly fruits. The very act of looking for evil in others develops evil in those who look. By dwelling upon the faults of others, we are changed into the same image. So I think, and as we go forward, we will talk about things on True Health Tuesday such as nutrition, sleep and rest, exercise, air, water, sunlight, avoiding toxins. We may even talk about medical conditions. We may even talk about medications that we use in some situations where there's an emergency measure and we need to prevent something from happening quickly. But I think a good way to start off the year is to learn to constrain our thoughts in temperance and to make sure that we are thinking about things that are productive, things that are beneficial, things that are towards promoting positivity and not dwelling on the negative, because not only is that a bad thing for other people, but it's also a bad thing for us. And may I also add to that is sometimes the desire to look at someone's actions, whether it be another person, whether it might be a group of people or even a government agency, for instance, and to assign a motive to that. I think what we do when we start to do that is we automatically think about the worst. And it says something about us as people. When we see people accusing other people of doing things, one of the first things in my mind that I think about is they could only accuse that person of doing it if they thought it up in their mind. So be careful what we accuse others of, because it opens up our minds to people and they can kind of read what we might be thinking. And I think it's important in other situations and in many situations to constrain our thoughts to what is uplifting and is good. And I hope you enjoyed today's discussion regarding constraining our thoughts and thankfulness. Thanks for joining us. We'll see you next time on